Up next, Patrick O'Gara is joined by Sir Magdi Yacoub, Professor of Cardiothoracic Surgery at the Imperial College of London, to discuss cardiac surgery in search of excellence.
Sir Magdi, good morning and welcome.
Good morning. Thank you very much.
What we're going to do in the next 10 minutes is focus on Sir Magdi's presentations that regard his journey in search of excellence. And it is our hope that we will be able to transmit to our listeners just a small glimpse of both the magnitude and scope of his imagination and altruism. Let's start, Sir Magdi, by your helping us define the word excellence.
When I thought very hard about the word excellence, particularly because of this lecture, which is in search, that means I'm still searching, I'm nowhere near achieving it. And I found that a definition which is rather superficial in the dictionaries and saying it's a special type of performance. To me, I thought there could be an alternative definition, which is to do with the search for the truth. That excited me a lot because I know that many philosophers of science have defined science as the search for the truth, and I think that is excellence to my way of thinking. Again, the idea that the truth is beautiful but it's not achievable actually does apply to excellence. In ancient Egypt, even the ancient Egyptians knew almost for sure that the truth, call it excellence, actually is beautiful. The goddess of truth, Maat, was the most beautiful goddess. And also, if you came near her, she flew away. And that means that you should keep running and trying to achieve, to get nearer to the truth, realizing that you'll never get there.
Well, the world knows you as a trendsetter and a giant in the field of cardiovascular surgery, ranging from your work on heart or heart-lung transplantation to reconstruction of the aortic root and many things in between. But we're curious to know, on a personal level, how did your journey in search of the truth start? And what were some of the influences that turned you in this direction over your illustrious career?
I started life by being born in a small village in the Delta in the north of Egypt. My dad was a general surgeon who moved around Egypt. So the first few years of my life were like a gypsy existence, moved from one town to the other. And at that time it was very hard, but it was a great lesson in adapting to the environment, making new friends, realizing what life is all about. These were the formative years. Then I had role models. One of them was my dad. Then I heard about Lord Brock, who was performing open heart surgery. And I was a kid then, and I said, my God, this is something exciting, particularly when my dad lost his youngest sister to mitral stenosis at the age of 22. And he was totally heartbroken and said this could have been corrected. That strengthened my resolve that heart surgery might be the way to go. Also, I had this passion for heart surgery because of the idea of three-dimensional structures and physiology and all what goes with it. And that passion grew, and the journey continued. I went to the UK, then came to the United States, to Chicago in particular, where it was a source of inspiration as well. Got very excited and then went back to the UK, got immersed in perfecting or trying to learn more and offering things, making all the procedures which I get involved with, be it neonatal surgery or valve surgery, be as perfect as possible. Then I thought to myself, what's all this about? Why are we trying so hard? And it was obvious that we're trying very hard to offer it back to the community. But what is the community? Where are they? And it was, to me, it was the local community where one has to serve, but also the global community which is almost totally neglected. And the statistics are really frightening and horrendous, showing that 80% of the population of the world suffer dreadfully from cardiovascular disease, and they are not having access to either the healthcare delivery, which people on this side of the world take for granted, or importantly, research, or allowing their own young people to realize their potential. And so that's what got me really immersed in a big way in global medicine, which I think now occupies a whole lot of my thinking and efforts.
It's really quite a wonderful example. You have provided us with snapshots of places that you and your foundations have established in Ethiopia and Mozambique and other parts of the world, including Jamaica. And I wondered if you could share with us your thinking around the hospital that you've established in Aswan, which, as our listeners should know, is south on the Nile compared to where you grew up, but certainly an area that you've described as being very beautiful, yet being bereft of the kind of medical care that your foundation can deliver. I'm hoping that you could characterize for us what kinds of services that you're now providing and who you're training and the patients that you're serving in that kind of an endeavor.
The center in Aswan, the Aswan Heart Center, is the product of a collaborative effort of a whole lot of us from different walks of life, mostly professionals, but also from other specialties, including business people. And it was chosen because of what you had said, Dr. O'Gara, that it is in the southernmost part of Egypt, in an area which is really very, very beautiful, but people there do not have access, not as much in any way, to services like people in the north. And this situation has been the same since the time of the Romans. Actually, life expectancy is lower in Upper Egypt than in the Delta. So that's why it was chosen. And also it has this history since the days of the ancient Egyptians. It fills you with awe once you get there. The services themselves are offering free of charge to the most needy, regardless of color, creed, or something, and that's needed. The best that cardiology and cardiac surgery can offer. The second is to train Egyptians who, there is a massive talent there. There are young people who are just rearing to go. They are really a pleasure and a delight to work with. And training nurses is also an important aspect because nurses have been neglected in this part of the world and blamed for a whole lot of things and not given either the training or the credit they do deserve. And so that's going on. And finally, research is built in the center. It's nearly 1/3 of the effort is directed towards research. The clinical service is 50 to 60% pediatrics. The research constitutes 1/3 of the effort, and the research goes from population studies to molecular studies, which are being established in the center.
It's wonderfully inspiring. And for our listeners who might be interested in becoming involved, what advice would you give them?
I would say come and visit and see what it is all about and how can you interact, because that is the basis of the whole thing, and that's how it all starts, that you see the amount of suffering and pain people have, and then we as professionals can offer a whole lot, and I'm sure the listeners, or each one of them, can have something to offer.
Fantastic. Well, thank you very much for spending this time and for encouraging us to think more broadly of our mission.
Thank you.